everybody, welcome to your favorite show, Youth Diaries. Urology is that field of medicine that deals with male and female urinary tracts and reproductive organs. Today, to talk about it, we have with us Dr. Sandeep Prabhakar, urology and andrology consultant of Urinary Medicity, Palarivata. Welcome sir to the program.
Thank you.
So these days you find an increasing trend in urinary stones. So what do you think are the basic reasons behind all that?
Yeah, you are right. There's an increasing trend of urinary stones nowadays because that can be attributed mainly due to the fast food culture in our population. Also, an unhealthy lifestyle we are adopting very fast.
So we have few inquiries about the topic. So the first one is this.
Hi, I am Binu. Can you explain the dietary risk factors for urinary stones?
The dietary risk factors for urinary stones are varied. The first and foremost important risk factor is high oxalate foods. The common examples for high oxalate foods are tomato, spinach, beets, nuts such as cashew nuts, almonds, hazelnuts, black tea, also chocolates. These are the high oxalate foods are the first and foremost important factor for urinary stone disease. Second most important factor is diet rich in high purine. Purine is a component which is converted into uric acid in our body. The high purine foods are meat, especially red meat, and also the seafood. I mean prawns and lobsters are very high purine rich foods. And third important factor is a high salt diet like canned foods, salted foods, salted peanuts, pickles, salted fish. All these things are increases the risk for urinary stone disease.
Okay, so basically it is that the new food culture is a basic reason for all this.
Yeah, partly.
Okay, thank you sir. So let's move on to the another question.
Hi, I am Munni. Can you explain the treatment strategies for urinary stones?
The treatment for urinary stone disease depends on primarily two factors: the site of stone as well as size of stone. We primarily divide the site of stones into three, mainly kidney stone, ureteric stone, and bladder stone. So,
which is the most relevant of these three?
Most commonest may be kidney stones. The kidney stones, if you divide by size, the treatment depends on the size of the stone. In a stones of size less than 5 millimeter, you don't need any treatment. You just advise conservative management. Just ask patients to nothing. We just ask patients to drink a lot of water, at least 3.5 liters of water, and some dietary modifications to be followed. And we ask them to follow up in our OPD after 6 months or so that we can have a repeat ultrasonogram or imaging studies to see whether stone is growing up or whether it has flushed out of system. So if it is less than 5 mm, there is no treatment is required. If the size of stone is between 5 mm to 2 centimeter, we have two modalities in offer. We have one is you must have heard extracorporeal shock wave lithotripsy, which is a non-invasive modality of crushing stones inside kidney without any surgery. Okay. In that modality, we push some shock waves to focus over the stones. Shock waves, okay. With some modified type of sound waves or pressure waves, which is generated by a specialized machine, and these shock waves will be focused over the stone, and these stones gets disintegrated.
So no operation, no surgery, nothing?
No, it will be done under a short sedation or sort of, and the patient can go home day itself.
Okay.
Okay. This is for the stones between 5 mm and 2 centimeter. There is another modality in offering for this type of stones, like moderate size stones, that is between 5 mm and 2 centimeter. That is called retrograde intrarenal surgery. That's a very complicated procedure, very expensive procedure. The retrograde intrarenal surgery is a modality which we use, which you do using a flexible ureteroscope. Very flexible and slender instrument called ureteroscope will be going through ureter and straight up to kidney, and we will plug the stones inside kidney without having any holes over the body.
Okay.
That's not even a keyhole surgery, that's a no-hole surgery.
Okay.
This modality is called retrograde intrarenal surgery, and it's available with us, and it's very effective modality for the.
So after this operation, this one, will you have any effects of it, after effect of it?
Normally the patient goes next day home after RIRS or retrograde intrarenal surgery. Okay. Coming to the next point, if the stone size is more than 2 cm, you cannot manage with these non-invasive modalities. You have to go for a percutaneous or keyhole surgery for a stone removal. In the modality we are using is percutaneous cystopnephrolithotropsy. PCNL. In this surgery, what we do is we make a small keyhole through the kidney and pluck out the stones through that tract. In this surgery, there is a little bit risk of bleeding, and patient have to stay in hospital for 3-4 days.
Okay. So in these 3 phases, is there any chance for the kidney stone to come again or to happen again?
Yeah, there is definitely a risk is high for any stone former to get another stone. It's said that 50% of patients within 5 years will have a next recurrent stone disease. So there is a definitely recurrence chance in all stone formers. For that, they have to adopt a healthy lifestyle, as well as they have to avoid some dietary habits.
Those are the stuff that you told earlier.
Yeah, I told earlier. That I will detail later also.
Okay. So doctor, what are the treatment procedures for stones stuck up in ureter?
Okay. For stones impacted in ureter, the treatment depends on the size of stones. If the size of stone is more than 8 mm, we directly go for a ureteroscopic, that's a endoscopic procedure, ureteroscopic lithotropsy. And that is we break the stones using an endoscopic instrument called ureteroscope. Okay. If the stone size is less than 8 mm, we normally give a trial of medical therapy to expel the stones out of the system for a period of 10 to 14 days. And if stones are not getting flushed out with this therapy, that is a cocktail of drugs will be given to relax the ureter, to have more urine and all. If stone is not still getting flushed out, we will go for the above mentioned.
Okay. So is the drug is like tablets, or is it like?
It will be 2 to 3 tablets given in together, which have multiple actions to get that ureter, which is a tube to get dilated, as well as to have more urine and all.
Okay. So these are the basic procedures.
These are the basic procedures.
Okay.